According to the American Cancer Society, pancreatic cancer represents approximately 3% of all cancers and 7% of all cancer deaths. It occurs slightly more often in men than in women. This awareness video contains information about types, symptoms, causes, risk factors, prevention, diagnosis and treatment of pancreatic cancer. The pancreas is a small, hockey stick-shaped gland located behind the stomach. The main jobs of the pancreas are to aid in food digestion and regulate blood sugar levels in the body. The pancreas is involved in maintaining blood sugar levels because it makes insulin and glucagon, two hormones that control blood sugar levels. Pancreatic cancer occurs when changes in the pancreas cells lead them to multiply out of control. A mass of tissue can result. Sometimes, this mass is benign. In pancreatic cancer, however, the mass is malignant or cancerous. Pancreatic cancer, which is not often detected early, tends to metastasize, spread, to nearby lymph nodes, then to the liver, peritoneum, which is the lining of the abdominal cavity, and lungs. Even though pancreatic cancer has a poor survival rate, it can potentially be cured if detected and treated very early. There are two types of tumors that grow in the pancreas: exocrine or neuroendocrine tumors. About 93% of all pancreatic tumors are exocrine tumors, and the most common kind of pancreatic cancer is called adenocarcinoma. Pancreatic adenocarcinoma is what people usually mean when they say they have pancreatic cancer. The most common type begins in the ducts of the pancreas and is called ductal adenocarcinoma. The rest of the pancreatic tumors, about 7% of the total, are neuroendocrine tumors, also called pancreatic neuroendocrine tumors, an islet cell tumor or islet cell carcinoma. Most people don't experience early signs of pancreatic cancer. As the disease progresses, however, people may notice upper abdominal pain that may spread to the back, yellowing of the skin and the whites of the eyes, jaundice, tiredness, loss of appetite, light-colored stool, dark-colored pee, weight loss, blood clots in the body, itchy skin, new or worsening diabetes, nausea and vomiting. Your healthcare provider might suspect pancreatic cancer if you have some symptoms and you've recently developed diabetes or pancreatitis, a painful condition due to the inflammation of pancreas. The average lifetime risk of developing pancreatic cancer is about 1 in 64. The risk factors include smoking cigarettes, cigars, and using other forms of tobacco. Obesity is also a risk factor. Carrying weight around the waist is a risk factor even if you do not have obesity. Having diabetes, especially type 2 diabetes, which is linked to obesity. The new development of diabetes at an older age and in someone with a normal weight or body mass index could be a sign of pancreatic cancer. Being exposed to chemicals used by dry cleaners and metal workers. Having chronic pancreatitis, a permanent inflammation of the pancreas usually associated with smoking and drinking a lot of alcohol. Other risk factors which cannot be controlled include hereditary chronic pancreatitis due to gene changes passed from parent to child. Hereditary syndromes with gene changes in genes, such as BRCA genes passed from parent to child. Being older than 45. Being male. Being black. The options for pancreatic cancer diagnosis include an endoscopic ultrasound in which a thin tube with a camera at the tip that is passed through the mouth and into the stomach. The ultrasound probe at the end of the endoscope allows imaging of the pancreas through the stomach wall. If necessary, an ultrasound-guided biopsy from the pancreas can be obtained during the procedure. A blood test can find a substance called a tumor marker. For pancreatic cancer, high levels of carbohydrate antigen 19-9, a type of protein released by pancreatic cancer cells, might indicate a tumor. Pancreatic cancer is categorized into 5 different stages. Your diagnosis depends on the size and location of the tumor and whether or not the cancer has spread. Stage 0, also known as carcinoma in situ, stage 0 is characterized by abnormal cells in the lining of the pancreas. The cells could become cancerous and spread to nearby tissue. Stage 1, the tumor is in the pancreas. Stage 2, the tumor is in the pancreas and has either spread to nearby tissues, organs, or lymph nodes. Stage 3, the cancer has spread to major blood vessels near the pancreas. It may have also spread to nearby lymph nodes. Stage 4, in stage 4 pancreatic cancer, the cancer has spread to distant areas in the body, such as the liver, lungs, or abdominal cavity. It has possibly spread to organs, tissues, or lymph nodes near the pancreas. Pancreatic cancer treatment depends on certain things, including where the tumor is located, what stage it is in, how healthy you are, and whether or not the cancer has spread beyond the pancreas. Treatment options include surgical removal. The cancerous part of the pancreas is removed. Lymph nodes near to the pancreas may also be removed. The surgery to remove the pancreas or part of the pancreas is called a pancreatectomy. Radiation therapy, in which high-speed energy used to kill the cancer cells. Chemotherapy, this method uses drugs that kill cancer cells. Immunotherapy, treatment to help your body fight the cancer. Immunotherapy has largely been ineffective against pancreatic cancer, but about 1% of people with pancreatic cancer and a specific genetic change may benefit from it. Targeted therapy, directed at certain genes or proteins that help cancer grow. Genetic testing is generally how we determine if a targeted therapy is right for you.